go to you, Keith, first, and then Rudy, I'm going to go to you. Rob, I'm going to save you for last because Rudy, I know you have the one guy story, and again, I know you can't tell his name, but obviously he is amazing. He's also in the private membership group. He's basically told us both and many of us that we saved his life. But Keith, again, I'm going to go to you first. I mean, why is this still going on? Why is this person, and again, it's Dr. Rand McClain, allowed to practice in this capacity, knowing what he does with his patients, putting them on AIs and keeping them at, a constrained estrogen range?
Well, I think that all of us, we've talked about even within our groups, our practices, Rob's and mine and Rudy's, we serve some of the same population, but we all have a different focus as well. And Rudy and the obesity clinic, and Rob doing a lot of, decontamination and, you name it. And I'm focusing on middle-aged men and women with hormones. But, a guy has some certain clinics are developed around their devoted population of men. And what I've seen from that clinic is they service the performance enhancing world, the bodybuilding world. And that's where, so in order to be able to, I guess, be profitable and have a patient, you have to make those patients happy, and those patients expect certain things. And the bodybuilding world, as you know, is not the hormone replacement therapy world, totally different worlds.
Right.
But you're gonna have to provide them with aromatase inhibitors in order to keep them as a patient, because they'll demand it, they think they need it mistakenly. And so and I think that I sent you the quote today, did I not?
Yes.
So yeah, I think that Upton Sinclair said it the best. It is difficult to get a man to understand something when his salary depends on him not understanding it.
Right.
And that's really what we're dealing with.
That's right.
And so, it's just servicing a population of men, and, that we don't service. And so I've said it time and time again, I see it every day. And whenever I see my men, I get them optimized. The first thing that I'll ask them, when they have those beautiful levels of hormones and testosterone, especially, I'll say, well, these are could you ever imagine have such wonderful levels of hormones? No, doc, they're best I've ever seen. They're great. Well, you having any problems? No, I feel awesome. I feel great. And I say, well, how can that be? I said, you're kind of dispelling a couple of things here. Number one, with those wonderful levels of testosterone, why are you not having any estrogen symptoms? I just don't. I don't. I said, right, because they don't really exist.
Because they don't exist.
And so I don't have a single man that needs it. And so they really look at these beautiful levels better than they've ever had. They don't have the problems they seem to have had before, and they don't need an aromatase inhibitor. And then, of course, with that, talking about the cream, Rand's put that on a YouTube video. That's anybody that says the cream is not effective immediately alerts you to that person has no true experience with the cream.
Right.
None.
Or clue. Let's just be
honest. So look, injections work. We all know that. But my platform is to say, look, there's another way that is just as good. And I'm also going to say this, just as good, if not better, for most men than injections, if done correctly.
Right.
And so we've been into this, how to do it correctly. I mean, I can go into, a tirade just on that alone. But nonetheless, it works. And so these men learned how well the cream works as good, if not better, than injections in most men. I didn't say every man. 90% of men on injections are fine with it. 10% or so, they don't like it. Doesn't work for them for whatever reason. Same goes for cream. 90% get on it, like it. 10% not going to like it for whatever reason. But to sit there and say that it doesn't work or it's not as effective is absolutely not true. Okay, so the only thing that I run into with that I've seen from a couple of patients was that also the utilization of anabolic steroids, prescribing anabolic steroids, which is not a part of bioidentical hormone replacement therapy. It's not a part at all. Not a part at all. And it's off-label use is not off-label use. All right. Off-label use would be for a true muscle wasting disease. None of these men that were prescribed had a muscle wasting disease. Okay. Right. They're guys that are in the gym every day, large muscles that's being used for performance enhancement. We all know that. So look, once again, I'm going to harp on the fact that we had to separate the worlds. The bodybuilding world, performance enhancing world is not our world. They're two separate worlds. That world is a world of misuse and abuse, and everything is focused on size and strength, where our world is all about health. Right. The focus on prevention of cardiovascular disease, insulin resistance, diabetes, you name it. Ours is about health.